Hello, everyone. My name is Evie Matthews. I'm here to speak on my personal experience as a patient. For the most part, I would say that I've had fairly positive experiences, whether they were visits with my primary care doctor, or attending a medical procedure, or going to the dental office. I had a positive or rather great experience when I had to undergo a minor surgery. Even though I was 10 years old, I still remember how well that day went. I remember being very anxious the day before and the morning of. But my local hospital did a great job with it. From entering the hospital and finding the patient waiting room and meeting the front attendant. She was she was very kind and super nice with me. She knew it was my first time going under, so she cracked a few jokes with me to lighten the tension. I remember having a conversation with her about what school I went to and then what sports I played, what was my favorite TV shows. But yeah, so she was definitely great. She was the saving grace for that day because she kept me, she made me feel that everything would go okay. So I remember 20 minutes later, the nurse came in and she got me out of the waiting room. She apologized for the long wait time. She brought everything I needed and explained how to put a hospital gown because I could not figure it out for the life of me. She got my measurements, my blood pressure, was checking if I followed the surgery instructions, making sure I didn't eat before the procedure. She had a brief conversation with me and listened to everything. She made me felt heard. She introduced me to multiple doctors that came to visit. I remember my anesthesiologist came in, the floor doctor, and the dermatologist. They were extremely professional and made the whole surgery painless. Procedure ended pretty quickly. I think it was only 30 minutes, so it was pretty quick. They allowed me to stay the whole afternoon and discharged me shortly after. This experience, it was very positive for me because I felt valued as a patient. I had all my concerns addressed and I felt pretty comfortable in their hands. I think fostering trust and communication between healthcare providers and patients is key for success, especially when undergoing a medical procedure like that. Now, a negative experience I would say was when I was visiting my orthodontist. It's kind of funny now thinking about it because I think that was a year later after my surgery. So I was about 11 years old at the time. I was getting my braces, and one of the technicians was applying the wiring on the new brace. And even though I was numb, I wasn't sedated, but I was awake. I still felt a lot of pressure, and I remember going home and I rubbing my tongue around the area, and I could feel cuts all over. I remember bleeding a lot during the procedure, so I was pretty hesitant on going back to the office. I remember talking to my parents during dinner and telling them that I didn't want to go back for a tightening session. But they couldn't really do anything. We already paid for the full procedure, so I was worried about going. I know a month and a half later I had to go back, and um, fortunately, the technician he was let go, so I didn't have that many ongoing issues after with them. I would This experience was definitely negative because it created an adverse event and it led to a minor trauma on returning to receive patient care. So I think these things did get better when my dad voiced his concerns later about how my gums felt after the procedure with the office. I think if they were apologetic on what happened, I think it would have made my patient experience better. But I don't remember receiving an apology at the time. Also, I would say that the patient definitely plays a role in the experience. I think ensuring a positive patient experience always leads to better outcomes. I think if you really show them respect and care as a caregiver, it really makes a difference in how they feel as they are being cared with compassion. And that is my patient experience. Thank you.